This physician testimonial focuses on a specific patient case where the use of SphygmoCor for central pressure waveform analysis changed patient management. In this video, Dr. Lee Marcus of Preventive Cardiology of New York performs a follow-up SphygmoCor assessment on a patient 4 weeks after making treatment changes. The patient is a 71-year-old male who had bypass surgery 7 weeks prior to this visit. He was taking amiodarone and metoprolol when he had his initial SphygmoCor assessment. Dr. Marcus removed the metoprolol and added amlodipine after seeing his initial results. Now the patient is visiting Dr. Marcus for a follow-up SphygmoCor assessment to determine if medication changes have been effective. When you first saw the initial report, how did that drive your decision?
Oh, it absolutely convinced me that the metoprolol, which he was on for atrial fibrillation, which is an appropriate treatment, and a lot of people and a lot of cardiologists like beta blockers after bypass or for people with coronary artery disease, they think that they're effective. However, there's compelling data looking at central pulse pressure from the Strong Heart study and from other studies, and looking at central derived indices showing that these parameters are much more predictive and much more prognostically significant, and therefore you need to act on numbers that are out of range. And so I felt utterly confident that I needed to wean him off of his metoprolol, which was reinforced to me by the fact that he was having some side effects from possibly attributable to the metoprolol. But in my old days of practice, I probably would have just lowered the dose and kept him on a lower dose of metoprolol and not gotten him off completely. Instead, based on prior studies with the SphygmoCor, done actually with the SphygmoCor device, I was simply comfortable switching him to amlodipine with his lisinopril. And within 4 weeks, and I bet you even within 2 weeks if I had checked it, we would have seen a result. But of course I had to wean him off the metoprolol, so his prognosis, I'm convinced, based on the numbers that I'm seeing here, is improved based on those changes, which was literally dictated by the SphygmoCor readings. This reaffirmed that I made the correct decision regarding his medications, and it's quite validating to know that you made the right decision. And his peripheral blood pressure didn't change much at all. So we would have thought he was exactly the same. If I had had a traditional method we would have said, oh, your blood pressure is still at a borderline, metoprolol is doing okay, let's just keep it up. In fact, some people might have increased his metoprolol. Who knows? I mean, without this, I feel almost handicapped. I do it on every patient, every visit. I just think it's indispensable at this point.
Central aortic pressure waveform analysis provides important information to better inform hypertension management under existing guidelines, specifically for assessment of individual physiology for directed care, treat, no treat decisions, and differential drug effects. Understanding the effect of arterial stiffness and wave reflections is helpful in diagnosis and treatment decisions to help with the decision to initiate, intensify, or change therapy, in the choice of anti-hypertension agents and regimen, and in the assessment of therapy effectiveness or the direction of further treatment. For more information, visit atcoremedical.com or email info@atcoremedical.com.